All right, joining us now is Dr. Nicholas Testa, who's got one of the greatest doctor names ever.
or electrical engineers.
Yeah, one of the two. He's the Chief Medical Officer for Dignity Health's Southwest Division. He oversees 9 different hospitals. Dr. Testa, thank you for being with us. And one of the things we want to talk to you about and give you credit for is Dignity is now doing some important free work when it comes to virtual health and coronavirus. Explain how it works.
Alex, thanks for having me on, and thanks for focusing on this. So we're rolling out a platform called Virtual Care Anywhere in partnership with Amwell, and it's a virtual urgent care. It's a tele-urgent care. You can download the app on your phone. It's Virtual Care Anywhere, and you can set up an appointment to see a physician or a physician extender if you're having symptoms that are concerning for something like the coronavirus, so a cough or a sore throat or a fever. And it allows you to avoid that trip to the emergency department in most situations.
My friends in the emergency room are telling me that they've been rather quiet lately, and because the people that shouldn't be coming in aren't coming in. So good news, everybody. You're not exposing other people or exposing yourself. But my question is, do you think these digital behaviors are going to stay with us for good? I hope so. What do you think?
I think that the world after the coronavirus, and there will be a world after the coronavirus, is going to be a different place. And I think what we've seen in the last few days around the growth of telehealth is going to be in place, because I think consumers are going to like these platforms more than having to wait in long lines and waiting rooms.
Yep, I agree.
And thank you for making this available for free for people, because that is one of the challenges, I think, is going to be insurance. So many people, their jobs and their insurance are tied together. So many people now losing their jobs, could be losing their insurance in the process. How are you as a hospital system preparing for what could be a major change in insurance in the coming months?
Yeah, right. So it's a great question, Alex. And so in regards to the care where the Virtual Care Anywhere app, there's a code. So if you enter in COVID-19 is the code, that first visit is free. And that's really important right now, right? Because we can't be thinking about cost. This is a financial hit to everybody, hospitals included. Everybody's taking a hit. So we want patients to get the care that they can access. It's going to be hard on everybody, and it's going to be hard for a while.
Well, thank you. Listen, thank you for that. I mean, that to me is, thank you. You're giving free services and keeping people out of ERs. I know you share my concern and Alex's concern as well with the panic and the mental health consequences and lives being upended by what we're doing to control this virus, where, as the president said, the treatment could be worse than the disease. What are we doing? What's your recommendations for the mental health? We're going to talk about depression a little bit later. What do you say?
Yeah, I mean, so firstly, I think that we need to be talking. So I appreciate both of you gentlemen doing this today and us focusing on what the facts are and being transparent. Fear is based on the unknown. Courage comes from knowledge. And right now we need to start pivoting away from fear and tapping into the deep reserves of courage that are in this country and in every single person out there.
Do you agree? I'm going to interrupt you. Do you agree that 800 cases in the multiple counties in the surrounding area here, 15 million people, 800 cases? We should be patting ourselves on the back.
I'm proud of where we are. What I like to say, about 2 weeks into this, I think we have, thanks to our mayor, to our county supervisors, we have really flattened the curve in this beginning part. And this is where it's critical, because it gives us time to put something like a telehealth platform that we've never had into place in a few days. And we'll have more stuff in place in the next few days, so that if this hits, when this hits, we'll be prepared.
All right, Dr. Nicholas Testa, one of the major movers and shakers when it comes to healthcare in California. We appreciate you taking some time to talk with us. We want to put some information on the screen. Information on, if you want to use that service, go to dignityhealth.org/virtual care anywhere. You can download that app, and it's free for the first visit. If you're looking at COVID-19, it's $35 for visits after that. Coming up.